Welcome, North Dakota, and welcome back to all the people listening in. Welcome back to all of the great North Dakota press corps that's here in the room, and special thanks to Lindsay, who's been through all of these press briefings with us. Today we've got, in addition to myself, we've got two other scheduled speakers, Molly Howell, who's the North Dakota Department of Health Immunization Program Manager, giving updates on vaccines, and then Dr. Christy Mason, who's the North Dakota Chief Laboratory Officer, will also be sharing information with us today. So thank you to Molly and Christy for being here. And again, thanks to all of you for joining us. Today, I know that we've got some in our press corps that love sports, as many of you at home do too. So using a track analogy today, we would say that from early on in this pandemic, it was clear that this was going to be more of a marathon than a sprint. But we didn't know how long that marathon was going to be. We started running, we started preparing before the pandemic hit North Dakota, but we started running last March 11th when we had our first case, and again, running that marathon race over uncharted ground. Some of that ground was flat, and we cruised through last summer fairly easily. As we know, we got into October, November, December last year. We faced some very steep uphill climbs, and now here we are in February. Our last prep briefing was on January 15th, but we're optimistic that while we don't know exactly when or where the finish line will be, we believe that we've got a easier path ahead of us than behind us, and we know that there are a couple of potential hurdles that may be in our path going forward that we're watching out for closely. But we do feel that as a state, thanks to all of you and the great efforts of so many across our state, that in so much effort by so many, that we're in a position to finish very strong coming out of this. And as all of you know, since our last press briefing on January 15th, we adjusted our North Dakota Smart Restart state risk level from moderate down to low based on the data. Our numbers have continued to trend in the right direction thanks to continuing actions by North Dakotans. We also lifted a number of executive orders, and the state health officer mask mandate expired since that time. And so even with those, the decisions we made in January about reducing some of our precautionary measures, our numbers have continued to move in the right direction. And again, as all of you do know, that since the beginning we've taken a data-driven approach to this pandemic. We've had two goals: saving lives and saving livelihoods. And again, our goal to do that was to make sure that we had adequate hospital capacity. And we've got good news on that front again, because as we know, when our hospital numbers increased back in early November and they were testing the limits, we implemented a number of protocols to break the chain of transmission. Again, thank you, North Dakota, for your part in doing that. We've seen steady progress since that time frame. When we take a look at the numbers here, our hospitalizations down 89% since that peak point. There's only 34 people hospitalized in the state of North Dakota today due to COVID. That's 34 too many, but it's a great progress. 92% drop in active confirmed cases and an 84% drop in our positivity rate. When we take a look at the next slide on our 7-day positivity rate, this is from the White House profile report, which came out earlier this week. We do not yet have 52 states, but in the White House report, they include Puerto Rico and the District of Columbia. And so among the 50 states and the two additional reporting, North Dakota, this is a list you do want to be on the bottom of. We have the lowest national ranking on test positivity in the country this week. So that's very positive. Again, great job, North Dakota. And when we take a look at the next slide, and we take a look at where we are in terms of deaths per 100,000. Again, deaths per capita was something that was a news item for our state last fall, but again, on this list, we are 50th out of 52 reporting districts. Only Alaska and Vermont are lower than we are. So again, great job, North Dakota. In terms of the national picture, always good for us to take a look here because I know that here in North Dakota, sometimes it may feel like that COVID is already a memory because it's in our past. But we still, of course, need to remain vigilant as we go forward. And one of the reasons we do, if you take a look at the red on that map, including popular areas like Arizona and Florida or Texas that many North Dakotans travel to and from in the wintertime. And well, nationally, we're down from 181,000 cases per day on January 21st. We're still tracking all this week close to 100,000 new cases a day in the country. And so many, and if you say, when was the last time we were at this level of about 100,000 cases, the country was at the same level back in November. So, well, things have improved in North Dakota, and the nation has gone up and down. Since then, we're still in a position where there's significant COVID prevalence in the United States, and we're still, sadly, nationwide, there are between 300 and 3,500 deaths a day still accruing with the people passing with COVID. So that's a quick look at the national picture. I'd say if we leave that up for one more second, on this slide, where the nation was almost all red, that was 2 months before. Then you can see things starting to break down the middle of the nation, including here in the Great Plains states. And then now with the national picture this week, again, you can see very, very positive results happening in the Dakotas and down to Nebraska from a national picture. So our immediate neighborhood is doing well. In terms of testing per capita, we continue to rank in the top 5 states for testing per capita, according to Johns Hopkins. And of course, we're continuing to roll out COVID-19 vaccines. We're currently ranked 2nd in the nation for COVID-19 doses. Behind Utah has made a surge here recently. And when we look at our other neighboring states, Montana doing a nice job, they're 5th. South Dakota is further down the line at 79.3%, and Minnesota at 76.4%. But those are all very respectable numbers. The national average, they're all above the national average, and some states are at 50%. And so again, in terms of vaccines actually delivered, we've delivered over 140,000 doses into people's arms. And you can see here that this chart has got a cumulative. It's going to continue to move up. We got a little bit of a flattening that you see each week. That's because basically when we receive doses on Monday, by Sunday, generally we've run out of doses. And so we've had low vaccination days on Sunday. You'll hear more about increasing supply, but one of the things that we're looking forward ahead to in the weeks ahead, as soon as early as March, when we have more doses available, then we're going to have to, as a state, be set up and in position to make sure that we're able to continue to do vaccinations on Saturdays and Sundays as well, to get the life-saving vaccines to as many people as quickly as possible. Another thing to mention is that last week Wallet Hub ranked North Dakota as the 2nd safest state in the nation. And for COVID-19, and that was after Alaska. Hawaii was 3rd. So if you're counting contiguous states, North Dakota was rated the safest state in the nation. That's based in part due to five rankings, cumulative rankings on vaccination rate, test positivity, hospitalizations, and death rate. And again, on that chart that was just up on death rate, you can see that we have moved to another list that we want to be at the bottom of, where we're at the very bottom of deaths per 100,000. How did we get to this spot? Well, we're grateful to all of the people in North Dakota that helped us achieve these positive trends. And again, I think it also goes back to our strategy, which we articulated some time ago. And we're going to give you an update on that strategy. Again, the three-pronged strategy we're talking about was, again, making sure that we had excellence in vaccination delivery. Molly Hall will talk about that shortly. Second, which we've talked about from this podium and stage before, was making sure that we're doing a great job of delivering monoclonal antibody treatments to those people who test positive. We'll talk more about that in detail today, but just as a headline highlight of those newly positive individuals who've received this treatment in North Dakota, the monoclonal antibodies, most of those people are over age 65. Less than 1% of the people receiving monoclonal antibodies have been hospitalized. That outperforms the 2% that was reported earlier by Mayo. And so again, this is something that's saving lives and saving hospital capacity. And then the last thing to make sure that we don't become complacent is making sure that we continue to drive a high degree of testing, moving from the PCR lab testing with multi-day results to rapid antigen testing, the 15-minute tests to help identify particularly asymptomatic carriers, help break the chain of transmission. And again, we are moving up this last Monday through Friday this last week. 40% of the positives we identified were through antigen testing, and that's significant because those individuals all found out immediately, not days later, that they were positive. And today may be one of the first days, but we had more antigen positives today than PCR positives. But this helps save taxpayer dollars and gets results faster to individuals. We encourage people to continue to get tested. You can find out testing locations and times at the website for health.nd.gov. This slide will also be up on the website, and this is for if you're a business with more than 100 employees and you want to set up rapid testing for your business, we've got tests for you. If you're a medical provider, in addition to the PCR testing, if you want to do rapid testing either for your staff or for your patients, we've got tests for you. We've got literally millions of dollars of, not millions of dollars, more than millions. We have millions of tests remaining of the rapid tests that we have available to share. And if you're a community, if you're a city, a police department, a sheriff's department, a school district, or even teams, we're happy to hear from you. Talk to one of our program managers. They're listed here. Give us a call or email us, and we can arrange to get tests to you because, again, we want to make sure that we are continuing to test for potential outbreaks, particularly as we're facing the possibility of new and more contagious strains that have been identified in the United States. So, again, the three legs of the stool, the three prongs on the strategy: vaccines, therapeutics, and testing. We're going to continue to drive hard on those, and of course all of that gets wrapped into the common sense individual responsibility of wearing masks when you can't physically distance and staying home when you're sick, etc. Those are things that we can all do to help slow the spread. When we talk about gratitude, which I've alluded to here, it's important for us looking ahead to keep focusing on all aspects of health, including our mental and behavioral health. We have to work hard to keep our economy open, as we are right now, among the most open in the nation. Many parts of the nation still have significant parts of their economy shut down. We've got long-term care visitation back open again in meeting the federal guidelines, which we're controlling skilled nursing visitation. Our kids, for the most part, are back in school. Last week, we had 80% of the students in North Dakota in face-to-face, 10% in hybrid, and 10% that were still in distance learning. And all of that activity, a strong economy, kids in school, universities open, child care open, visitation for our elderly and congregate living, all of that is contributing to the overall health of our state. But to make all this work, it takes so many. It takes healthcare workers, frontline workers in long-term care, educators, businesses, local public health units, law enforcement, federal partners, first responders, so many Team ND members and Department of Health and other state agencies who are working together tirelessly to continue to save lives and livelihoods and keep our numbers at the top of these leaderboards and heading in the right direction. And let's, so again, gratitude to all for this, great position that we're in today. Let's keep it there. As we look, again, deeper into the numbers, we're down now to 759 active cases of COVID-19 in the state. And as I mentioned earlier, there's only 34 individuals that are currently hospitalized with COVID. The numbers of work that's been done by, again, so many, including those at the state lab here, really incredible. Over 1.5 million tests of North Dakotans, close to 400,000 individual North Dakotans that have been tested. And then again, the fact that through all that work, we did identify over 98,000 positive cases. And because of that work, identifying those people, getting them either into a position where they received care, or if they're asymptomatic, breaking the chain of transmission, that alone has helped certainly save lives and livelihoods. Sadly, we've seen 1,429 individuals who've passed away with COVID. Only 5 in the month of February, so we're pleased when we have days when the number is 0. But again, to all those who've lost loved ones during COVID-19, the First Lady and I and Lieutenant Governor Brent Sanford, our hearts and prayers go out to the families and friends who've lost loved ones. But we can celebrate that 96,000 North Dakotans who've tested positive have recovered, and we want to keep that number growing as we drive the number of deaths to 0. Regionally, let's take a look at how we're doing. We know that this COVID doesn't pay any attention to state borders, and so we were last fall in the middle of a national and regional COVID storm. Now the skies are clearing, so to speak, in this part of the country. And regionally, new cases in the Midwest, upper Midwest, and over to the Rockies continue to decline. But again, across those states, there still are significant numbers. Illinois still with 19,000 new cases in the last 7 days, 8,000 in Wisconsin, 6,100 in Minnesota, nearly 2,000 in Montana, about 1,000 in South Dakota, and North Dakota leading the way with the fewest new cases in the last stretch of time at 387. So again, great job, North Dakota, on breaking that chain. And again, when we take a look regionally at the Johns Hopkins, how they track positivity rate, North Dakota has the second lowest positivity rate at 2.7, lower than all of our contiguous neighbors. I do want to give a shout out to Wyoming. They have a low positivity rate in the region at 1.2%, and part of the reason they've adopted a very aggressive at-home saliva test, and Wyomingans have taken over 56,000 tests in the last week. So Wyoming is a sort of a spotlight state in terms of doing a great job of surveillance testing. Our statewide 14-day rolling average is 2.57% today, or 2.6. It continues to decline. We were at about 4% at the beginning of the year, and a peak of 16% back in November. When we take a look at the county data here, we can see that 9 of our 53 counties have no active cases of COVID-19 right now. Only 2 counties in North Dakota have case counts higher than 100. That would be among our 2 most populous counties, Burley with 153 cases and Cass with 125. And we take a look at those as metro areas. The Burley-Morton and Cass Clay, when you put them both together, they each have about 200 active cases in those areas. But from a population standpoint, the Cass Clay market is about twice the size as the Burley-Morton. And so again, when we look at prevalence in the state, if we do that on the next chart, you can see that Burley is got about, well, it has the most cases. It's got about double the prevalence of Cass County. We have some smaller counties where the data gets a little skewed because we have low populations and we might have a small outbreak, which drives them up. But again, we continue to encourage everyone across the whole state, and including those that are either traveling to, working in, or living in our larger metro areas and our larger population counties, to make sure they're continuing to practice the North Dakota SMART guidelines and personal responsibility to help break the chain of transmission and protect yourself and protect those around you. We see that we have got, when we look at the counties across the state, the good news is we've got 26 counties now that have 10 cases or less. And again, but when you see those numbers pop up darker, that's when a hot spot pops up in some of the less populous counties, which is again why all of us, whether rural or urban, have to remain vigilant around the spread of COVID, particularly with the more contagious variants potentially arriving now. They're in the United States, not yet in North Dakota, but we have to remain aware as we work to get enough of our population vaccinated that we can start to think about reaching community immunity. On the vaccine update, again, which is one of the part of our key three-pronged strategy, with rapid testing and therapeutics being the other two. Safe and effective vaccines are a key component to our efforts to return to normal. Yesterday, we participated in a call with the White House's coronavirus team, and a majority of the nation's governors were on that call. This focused largely on vaccine supply and distribution. There's some new announcements coming out about potential increases in supply and lots of other updates on vaccines, but here to provide an update on that topic, none other than Molly Howell, Immunization Program Manager at the North Dakota Department of Health. And of course, I want to share my gratitude to Molly and her entire team to all the work they've done to make North Dakota a national leader in vaccine administration and all their work to protect our citizens. Molly?
Thank you, Governor Burgum. Good afternoon, everyone. As Governor Burgum mentioned, as of this morning, North Dakota has administered 141,267 doses, and so far we have received 178,375 COVID-19 doses in the state. And so as of this morning, 79.2% of those doses had been administered. So 12.2% of North Dakotans have received at least one dose of vaccine. And again, I just want to thank all the staff at the Department of Health, from my staff to emergency preparedness, who's been traveling around the state dropping doses off, and then also healthcare providers who are administering this vaccine as soon as they receive it. North Dakota's COVID vaccine allocations are increasing, and so that's good news. Vaccine is still fairly limited in the state. So for what was delivered this week, we received 4,875 Pfizer doses and 6,900 Moderna doses. And then on top of that, starting this week, Thrifty White Pharmacies, which they have 30 locations across the state, received 2,300 doses, and they're going to receive that each week moving forward. And so we did receive notice yesterday that for next week, our Moderna allocation will be increasing to 7,500 doses, so an increase of 600 doses. And so it'll be 4,875 Pfizer, and then 7,500 Moderna, and then the 2,300 Thrifty White doses. And then sometime in the near future, the federal government's going to start doing allocations to federally qualified health centers. So North Dakota has 18 federally qualified health centers. We don't yet know how many doses this will mean for North Dakota, or which health centers in the state will be receiving direct federal allocations. Some of that information should be coming out in the near future. My understanding is next week they're starting with a pilot of 7 states that will be receiving doses for federally qualified health centers. I did want to mention that on February 16th, you might notice a change in our allocations. And, well, it starts February 16th, but you probably won't notice till the following week when we receive the doses. But Pfizer doses, you may have heard of people getting extra doses out of the 5-dose vial of the Pfizer vaccine. Pfizer is going to officially now be a 6-dose vial, not a 5-dose vial. And so instead of the 4,875 doses, North Dakota will receive 5,850. But it's really, we're getting the same amount of vaccine. It's just being accounted for as there will be 6 doses in every vial of Pfizer vaccine. Most healthcare providers in the state are currently vaccinating in phase 1B. Many of them now have moved past that 75 and older and are into people 65 and older with underlying health conditions. Some are even vaccinating people 65 and older regardless of health conditions. People should look at our COVID vaccine locator on our website, where providers indicate which priority group they're currently vaccinating and whether or not they have vaccine. And then providers also provide instructions to the public as to how to access vaccine at their site, whether it's an online registration or a hotline. And then additionally, Thrifty White has a really good website, and it shows how many doses they have by location, what appointments that they have available by location. And so you can also go to Thrifty White and you can register on their website for vaccination if you're eligible. I just want to mention that I hope there's people not waiting for their traditional provider to get vaccine. There's a number of different providers who have vaccines. You may need to get your COVID vaccine at a pharmacy, local public health, or a different private provider. And so that's why that COVID vaccine locator is so important. We are a little concerned that there might be some who don't have access to the internet or don't know how to use our COVID locator or some of these registration sites. So please help a neighbor, a family member, a friend. If they're 65 and older, help them get access to vaccine. Or people can also call our hotline, and we have people staffed at our hotline that will help people find COVID vaccine and facilitate them getting an appointment if they're eligible. And that number is 1-866-207-2880. And so if you're 65 or older, have underlying health conditions, or especially if you're in the 75 and older group, please make sure you're looking for a vaccine now, you're eligible for a vaccine now, and use our COVID locator or call our hotline. I also want to remind people who have already received a first dose to come back for their second dose. The Pfizer vaccine, you need 2 doses 3 weeks apart, the Moderna vaccine 4 weeks apart, and providers will usually schedule these doses your second doses at the time of first doses, but please don't forget, because you really do need 2 doses to ensure optimal protection for the vaccine. And then again, we are encouraging providers to move through the priority groups quickly and use vaccine as they receive it, and so they'll keep going in order of priority for phase 1B. Since we last met, the Advisory Committee on Immunization Practices held a meeting on the 27th of January. A lot of that meeting was devoted to COVID vaccine safety. And I just wanted to mention some of the highlights from the meeting, because I think there has been some concern about vaccine safety. The United States has one of the greatest vaccine safety surveillance programs in the world. There's multiple systems looking for different safety signals related to all vaccines. At the time of their meeting, more than 23 million doses had been administered. It did show that vaccination may cause headache, fever, muscle aches, joint pain, and that side effects occur more frequently after the second dose. It also showed that anaphylaxis can occur, but it's very rare. And then they look specifically, you may have seen social media reports of so-and-so died after vaccination. And they looked at data to see, are we seeing more people die after vaccination than what we would expect to see? And it appears that it's a temporal association, meaning that vaccination is not associated with higher deaths than what you would normally expect to see. And they looked at this also specific to long-term care. And so all in all, the meeting was very reassuring, and the public should feel confident in these vaccines, that they are safe, and there were no concerning safety signals identified. I also wanted to talk about the Johnson & Johnson vaccine, which you may also hear as the Janssen vaccine. Johnson & Johnson submitted their COVID vaccine candidate to the FDA for emergency use authorization on February 4th. The FDA's Independent Advisory Committee meets February 26th, and depending on what their decision is, they may decide to authorize the vaccine for use, and if they do, it could be available as soon as the first week in March. We don't yet know what quantity Johnson & Johnson has of this vaccine or what that will mean for North Dakota allocations. This vaccine is different from the 2 mRNA vaccines that are currently available in the United States. It's a non-replicating viral vector vaccine. The benefit of this vaccine, it only requires 1 dose, so you don't need 2 doses. And it also is a refrigerated vaccine, which if you're a healthcare provider, you know what that benefit is, but it's a lot easier to maintain and have on hand for multiple people and at different provider sites. The phase 3 clinical trials for the Johnson & Johnson vaccine were done across 3 continents and included almost 44,000 people. In the US, it was found to be 72% effective and at preventing moderate to severe COVID, and 66% effective globally. The trial did include South Africa and Brazil, and in South Africa, the vaccine was 57% effective. Where South Africa is seeing 95% of their cases of that variant that you'll probably hear about a bit later. But I want to stress, this vaccine offered complete protection against hospitalization and death 28 days after vaccination, and it offered 100% efficacy of severe disease 49 days after vaccination. And so I know there's been a lot of media about the efficacy and trying to compare this vaccine to Moderna and Pfizer, but this vaccine will prevent hospitalizations and deaths. And also the Moderna and Pfizer vaccine, when they were in clinical trials, it wasn't when variants were going on, so you can't do a direct comparison between the 3 vaccines. Let's see here. And then just some late-breaking news since I even got here. We did just recently find out that the CDC is no longer recommending or no longer requiring that individuals quarantine after exposure to COVID-19 if they've been fully vaccinated and it's been 2 weeks since their last dose of vaccine. And so for people right now, for the current vaccines, if they've had 2 doses and it's been 2 weeks since their last dose, and the last dose has been within 3 months, because that's what we have data for so far, they no longer have to quarantine if they're exposed to somebody who tests positive to COVID-19. And if Johnson & Johnson is approved, even if that's a single dose vaccine, it'll be 2 weeks after the single dose vaccine. And so just more positive news for the vaccine. They just really feel, based on the efficacy, that people no longer have to quarantine. But I do want to say this is if people don't have any symptoms. So if you have symptoms, you should still be tested, of course, and could possibly have COVID. So that's for asymptomatic individuals. When trying to make a decision on whether or not to receive COVID-19, we really want people to weigh the benefits and risks. And so the risks of disease as it currently stands, 1 in 540 North Dakotans have died from COVID-19. 1 in 200 have been hospitalized. Many have had long-term effects from the disease, and then the potential to spread COVID to loved ones. The benefits of vaccine, of course, high protection against COVID disease, hospitalization and death. Some of these vaccines may prevent transmission to others, and vaccine is our way to get back to normal. And of course, the minimal risks of vaccination are the side effects that I previously mentioned, and the rare severe allergic reactions, also known as anaphylaxis, which currently for Pfizer, they're reporting 5 cases of anaphylaxis per 1 million doses administered, and for Moderna, it's 2.8 per 1 million doses administered. And so people should go to our website or CDC's website for more information about COVID vaccine. We have a really good fact sheet on our website about the vaccine, and then of course our COVID vaccine locator for those who are interested in finding vaccine in North Dakota. Thanks.
Thank you, Molly, and Molly will be available for questions, but thanks for that boatload of positive information. And again, just to reiterate that, again, when we're thinking about vaccination, it is extraordinarily effective at protecting you from the virus and protecting you from ending up in the hospital and protecting you from death. But I think the thing is you're considering vaccination to understand that there's a role that you can play by getting vaccinated, because you can end the damage that the COVID pandemic has had, to our disrupting our lives and our economy. You can help prevent more illness and death, and you can help eliminate and eradicate this pandemic. So it not only protects you, but it protects your loved ones, your community, your school, and as Molly said, all of these vaccines, all three of them, 100% effective at preventing hospitalization and death. When we talk about variants, which is our next topic, on the White House call that we had on Monday, the new federal CDC director, Dr. Rochelle Walensky, gave a update and warnings about COVID-19 variants that are a threat and could potentially reverse our nation's recent declines nationally in COVID cases and hospitalization. She urged people to continue to wear masks, stay 6 feet apart with people they don't live with, avoid unnecessary travel, crowds, poorly vented areas, and get vaccinated when it's available to you. There's also new information out today we'd refer people to if people have got concerns or underlying conditions about the benefits of double masking. I'll refer that to the CDC. That's just out today. We haven't detected these new variants yet in North Dakota, but they are traveling across the country. Just because we haven't detected them doesn't mean they may not have already arrived. So it's important that we continue to observe the North Dakota SMART guidelines around COVID etiquette and protocols. But here to discuss how we're making sure that we're on the lookout for these variants is Dr. Christy Mason. She's the Chief Laboratory Officer for the North Dakota Department of Health, has been a regular contributor to these press briefings, and she's done a great job of overseeing the outstanding North Dakota State Lab, which has, of course, had to expand its testing capacity manyfold to get us through this emergency. Dr. Mason, good to have you.
Thank you, Governor Burgum, and welcome everybody. Yes, I'm here to talk to you just a little bit about what the Public Health Laboratory is doing to watch for these variants. We actually started performing what's called whole genome sequencing back in May. And so that's one of the tests that we use to kind of confirm and identify different variants that are out there. However, in December, when we started to see more of these variants, we started to become very aggressive in how we were working towards screening for them. Like Governor Burgum said, to date, we have not seen any identified cases associated with the primary variants that CDC has identified, and that's, of course, the UK, the South African, and the Brazilian variants. But again, remember, it's very normal for us to see variants. That's kind of what viruses do. They mutate as they go. We see this with other illnesses, but we want to pay particular attention to those that could potentially threaten during this pandemic. So again, do we think that we have these variants in North Dakota? It's entirely possible. We just haven't identified or have lab confirmation of them just yet. It's very likely that we'll see them in the state as they move through the U.S., but we're working hard to make sure that we identify them hopefully as soon as we see them enter our state. And to do that, we're being very strategic in how we're screening our results. We are actually able to screen most of the positive samples that come through the public health lab for the variant. And there's a number of different ways that we can do that. One way is that we watch our raw data and our CT values for particular signs to help us. We also lean heavily on the Division of Disease Control after their case investigations to let us know if they have a particular case of interest that they would like further testing done on. So for example, they may have come across an individual that has traveled to a high-risk area for one of these variants or has been a close contact to one of those individuals. In addition to that, we're working closely with our partner at the CDC, the Center for Disease Control and Prevention, and we are actually submitting a random sample of 17 of our positives every 2 weeks to them. This helps promote whole genome sequencing on a national level and also helps supplement the amount of tests and whole genome sequencing that are done on positives within our state. We also are encouraging hospital and clinical laboratories around the state to submit their positive samples to us for further analysis and potentially whole genome sequencing for these variants if they receive them. We have been receiving some from some of our partners, but we encourage anyone who's doing whole genome sequencing or PCR testing to submit your samples to us so that we can do further testing. But again, I just wanted to remind everyone that because of these variants that are circulating around the US, it's very important to make sure that we continue to practice our COVID precautions like wearing a mask, physical distancing, staying home when you're sick, and also getting the vaccine when it's available to you. I was actually fortunate enough to get my second and final dose of the vaccine 2 weeks ago, and I'm very thankful for that opportunity. I know that's just one more step that I'm helping prevent the spread of this disease. And again, remember that if you don't feel well, to stay home when you're sick so that we can get through this. And if you do feel sick, I highly encourage you to get tested. That's one of the ways we're going to be able to identify if there's a variant present in our state. So testing is incredibly important. And remember, the test is free at this time, and it definitely will help us have a better picture of what's going on within our state. And I can stick around for any questions you may have. Thank you.
Thank you, Dr. Mason. We talked earlier about our three-pronged strategy and therapeutics being one of those, and our team is doing a great job on this front as well. During the first 6 weeks when these treatments were available across the nation, we received some from the federal government. It was a little unclear about how effective they were, and because they were so new, it kind of got buried under a lot of other news, and so it wasn't really a top line. We talked about them regularly at our press conferences, but we've had some great champions here in our state, including Dr. Josh Ranum and others that have helped get the word out about these. And what we see here is that we went during those first 6 weeks, is that first orange bar, 475 infusions were administered. Now we're doing just about that many per week, and some weeks more than that. We're averaging 445 a week. So our utilization has been increasing despite the falling daily positive cases, which means that we are reaching lots of people that can benefit from these. The state of North Dakota is, if you test positive and you're over age 65, you'll get a call from the North Dakota Department of Health sharing with you the effectiveness and the capability and how to get in contact with your medical provider to talk to them about whether these are right for you. But as I shared at the outset, of the 2,252 individuals that received these therapeutics in North Dakota, the majority of them over age 65, many with underlying symptoms or underlying conditions. Only 22 or less than 1% have been hospitalized, which supports the decreased risk of hospitalization post-infusion that we'd previously heard about from the Mayo Clinic study, which was at 2%, so this is even better than that. And so one of the keys to the success of this helping drop our numbers of hospitalizations has been ensuring that healthcare providers and both healthcare providers that would administer these infusions and the newly identified COVID positive individuals are aware of the treatment's availability and aware of its effectiveness and its safety. And so again, thanks to all at the North Dakota Department of Health, thanks to all of our medical providers that continue to spread the word through education, public service announcements, and others, because like the vaccine, these these are truly life-saving therapeutics. And again, a special thanks to Dr. Josh Ronham, who works out at West River Health Center in Hettinger, but he's been on statewide TV and radio and recently featured in a great story in the Grand Forks Herald talking about the benefits of these. So for more information related to this, you can go to the health.nd.gov COVID treatment. But again, and a highlight on this slide here, who would benefit from this? We talk about the fact that from a medical guidelines, anyone over age 65, even without any underlying conditions, is eligible for an infusion of monoclonal antibodies. But if you are over the age of 12 and have a set of immune deficiencies or serious disease, so even for young adults, if you're 55 and older and you've got multiple underlying conditions that have been identified as being a troublesome to or leading to hospitalization or death for COVID, you're also eligible. So again, if you're over 65, we'll be reaching out to you. If you're in these other cases, make sure that you are talking to your healthcare provider or visiting our call center to get more information about the life-saving capability of these therapeutics. Next topic is long-term care visitation. Even as early as last summer, North Dakota was a national leader in working to make sure that we could connect families with their loved ones in long-term care. And we then in the fall, during the pandemic, when things were heating up, the Trump administration made a decision nationally through the leader at that time of CMS, Seema Verma, Centers for Medicaid and Medicaid Services, that they would be controlling visitation rules based on the county's weekly positivity rate and the facility's COVID staff. CMS, under the new administration, is still administering the visitation rules at a federal level for skilled nursing facilities. And we have 78 skilled nursing facilities in North Dakota, and of those, approximately 80% currently meet the criteria for indoor visitation. And again, that's based on the county weekly positivity rate and the facility COVID-19 status. We have two other forms of long-term care in North Dakota, one called basic care and one called assisted living. 61 basic care facilities, 69 assisted living facilities. This is where North Dakota versus the feds are in charge of visitation. And of those, 100% of those basic care and 100% of the 69 assisted livings are eligible today for indoor visitation, and 97% of them are eligible for indoor in-room visitation. But again, this is very positive news. And again, statewide right now, we have only 5 positive residents and 12 positive staff in our skilled nursing centers in terms of COVID. No positives in basic care, and only 1 positive resident and 3 positive staff in assisted living, compared with the same group, over 1,000 cases in long-term care across those 3 categories, residents and staff, in mid-November. So we've come a long way in protecting our most vulnerable, and again, want to thank those that work in long-term care, and want to thank all of the great work that's done on testing to make sure that we can continue to maintain visitation and do it safely for those elders in our communities. And again, if you're visiting those facilities, we've got all of these rapid tests. Not a bad idea to know your status before you visit. Again, you can check our hotline, our websites on where you can get tested, but lots of free testing sites that still continue to exist across our state with rapid results. And of course, when you're visiting or preparing to visit your loved ones that may be elderly with underlying conditions, remember all of the North Dakota SMART protocols, including wearing masks, physically distancing, washing hands, etc., so that we can keep the visitation open at all of our facilities. Next topic has to do with a hospitality grant. We know with the decrease in travel and work that was done, more and more work that was done remotely, that those involved in the hospitality industry, including restaurants and hotels, were particularly hit by this. That's why last year we directed some of our coronavirus relief funds that the state of North Dakota received to the Hospitality Economic Resiliency Grant Program, or the HERG, affectionately known as HERG. And that Commerce still has more funds available, so they're opening up another round of applications, and we expect that there's over 30 million in remaining funds that are available to support restaurants, bars, breweries, cafes, and similar on-site dining establishments, including restaurants inside of hotels, that they'll reimburse businesses for operational costs such as payroll, rent, utilities, technology, et cetera. And of course, those receiving these grants are required to comply with the North Dakota Smart Restart guidelines. North Dakota has over 3,400 restaurant and bar licenses throughout the state. Commerce has awarded grants to 1,000 grants to restaurants and bars. That means many others, 2,400, have the opportunity to apply. In addition to restaurants, other eligible entities include theaters, drama and music and entertainment venues, and professional production companies that support major venues, meetings, and events. Applicants may receive up to $25,000. Eligible entries with multiple locations may receive up to $75,000, with a maximum of $25K per location. Any additional information about grant program is available at the ndresponse.gov website or the Commerce Department, North Dakota Department of Commerce social media channels. As we have since the very beginning, we've talked about the importance of behavioral and mental health at each one of these press briefings. And as we continue to focus on supporting the behavioral health of students, families, school personnel, the Department of Human Services Behavioral Health Team has developed resources to connect individuals working in schools with behavioral health support and services, including free crisis counseling and behavioral health services. In addition, the Behavioral Health Division of the Human Services Department of the state of North Dakota has recently contracted with the Central Region Education Association, resulting in the development of a great new program called Be Hero, which stands for Behavioral Health and Educational Resources and Opportunities. It's a technical assistance center. The vision of Be Hero is that all school personnel will develop the knowledge and skills to support the health and well-being of every student and family. Be Hero develops, curates, and disseminates resources and opportunities weekly to support those working in education, their students and families. We know from talking to educators, school leaders, school board members, and families around our state over the past 3 years that behavioral health in schools is a top priority. This is a great new program, and you can find out more about it at behavioralhealth.nd.gov/education. And again, also a reminder, as we do each briefing, there's free and confidential crisis counseling services available to all North Dakotans at 701-223-1510, or visit the behavioralhealth.nd.gov. Help is here on the website. In closing, with gratitude, as we've had a lot of that today because of the great position that we're in, we can have gratitude as a state for having the place where we are today versus and what we've come through, and that we've emerged from all of this even stronger than we entered it. But I wanted to share a quote today from 94-year-old Benedictine monk David Stendhal Rast, and he talks about what grateful living can replace in our lives. And grateful living can bring sharing in place of greed. It can bring respect and replace oppression. And it can bring peace, replacing anger and violence. As we began 2020, we talked about it being in it together. We saw many times during the year that the pandemic brought grief and anger and frustration to people, and there was often a framing during the pandemic about we and they. But I want to remind people as we get to this closing point today that with the pandemic, with all of us able to either contract or transmit this deadly virus, there is no we and they, there's only us. And as we close out today, there's three things that we should be thinking about. One is that we should be looking forward to a brighter future in 2021 because we are in a great position to finish strong and come out of this better than we went into it. The second is we should all continue to do what it takes to process whatever grief we may have for the things that we missed or lost, whether it's events or family gatherings or the loss of life of a loved one, to process that grief and to let go of the anger. And at the same time, know that even in the face of that grief, there's so much to celebrate here in North Dakota, and celebrating our success and the amazing work of our citizens. There's nothing more remarkable than the incredible work of North Dakotans sacrificing and doing great work for others. You saw two examples of that today from our speakers here today, and they're also available for questions afterwards. But again, want to thank all of the members of Team MD who's done amazing work throughout this entire time. And so we open with gratitude, we close with gratitude, and we're grateful again for all of the media that's here, and we stand ready for your questions. Thank you. Got one online?
For Molly, actually.
That's perfect, whoever it is online. Good call to get the experts up here. Here comes Molly.
Dave Kolpak with the AP in Fargo. Have you found any areas where providers have not been able to find enough people to take the vaccine they are allotted, whether that be because it is difficult to get the word out or people don't want to take the vaccine?
I think providers have really been working together locally, and so if one provider has extra doses, they've been able to transfer it amongst each other in local areas, so that's been working really well. Through yesterday, we had 25 doses that were reported as wasted. Not all of those are expiration. Some of it is a vial breaking or a needle stick or something like that. And so when you look at, the over 100,000 doses that we've received in the state, only 25 having been wasted, I think that's acceptable. And so far, they've been able to work together locally and make sure all the doses are getting out. And I think it's helped. We want people to keep moving down the list. And so if you're not getting people 75 and older to sign up, then, include people 65 and older with underlying health conditions. So I think that's helped quite a bit. Are there other questions for me? Yep.
Can you explain the difference between, excuse me, the viral vector vaccine and an mRNA vaccine?
Yeah, sure. So the mRNA vaccine uses basically messenger RNA to present the spike protein, and your body creates antibodies then to that spike protein on the outer shell of the virus. The non-replicating or the non-viral, I need to get it correct here. I don't want to say it incorrectly here. The non-replicating viral vector vaccine, what it's using for Johnson & Johnson at least, it's taking adenovirus that can't cause adenovirus. So adenovirus causes like common colds and illnesses. It's unable to replicate the adenoviruses. And so it's using that adenovirus then to present that spike protein, and your body creates antibodies then to the spike protein. So both of them work on that spike protein. Jeremy?
You mentioned the 2,300 doses that'll be going to Thrifty White. What's the breakdown between Moderna and Pfizer for those?
The 2,300 doses that are going to Thrifty White are all Moderna.
And I guess a follow-up, is there a reason that we haven't seen much of an increase in the Pfizer doses coming into the state?
That's a really good question. My understanding is Pfizer has promised to deliver 100 million doses by the end of March, and as have Moderna. I think with this extra dose that's coming out of the Pfizer vials and them being able to include 6 doses, that will help somewhat. But I did see recent media reports that they found some manufacturing efficiencies and will be ramping up manufacturing, so hopefully Pfizer will be able to increase their doses in the near future. Dave?
Thank you. Now we're in 1B, correct?
Correct.
Any idea or any rough idea when we could get to 1C?
I always have a hard time when people ask me timelines, and I'd love to give people timelines. I'm in 1C. I want to know the timeline. It's difficult with not knowing quantities of vaccine moving forward, and then it's hard to know because we don't know what uptake is going to be, meaning how many people, say, 65 and older want to get vaccinated. Is it 100%, 75%, 50%? And so all of those are kind of taken into consideration. I've kind of been saying we'll be towards the end of 1B in March is kind of what I'm thinking when I'm looking at current coverage rates and estimates by population, but you can't hold me to that, so. Yep.
Molly, over the past week, I've noticed on social media a lot of people saying that they fit in either category 1A or 1B and still haven't been able to get the vaccine. Is North Dakota as a state just not able to keep up the supply to the demand, or have there been other reasons why people have been turned away?
If somebody's in 1A, there should be no reason why they can't access vaccine. And so I encourage them to call our hotline or use the COVID locator, because everyone in 1A should have access to vaccination. For people in 1B, some providers are still on 75 and older. Others have started moving into the 65 and older. But yeah, if you're in 1B, not everyone in 1B yet has been offered vaccine, and so it's really going in order of priority. But for sure right now, I would say if you're 75 or older and haven't gotten access to vaccine, either use our COVID vaccine locator or call our hotline, and we will make sure you get access to vaccine. We're also planning on sending direct letters to everybody in the state 75 and older who has not yet been vaccinated to make sure they know, their turn is up, you need to go in and get vaccinated. Any other questions for me? No? Okay.
Jacob. Perfect. Thank you, Jacob.
You're welcome. With the ramping up of rapid antigen testing, but over the past few weeks, the rolling average of daily tests has gone down somewhat significantly. Just wondering how the rapid tests are reported, if at all, and if the testing numbers we see from the DOH should be interpreted differently from data we've seen in the past.
So I think I can answer these questions for you. The reporting mechanism is still the same. And actually, the reports don't necessarily come to the public health lab. They actually go to the Division of Disease Control, which is Molly's crew. And so they're getting reports just as normal and turning that information out. But we definitely have seen a decrease in people wanting PCR testing because the rapid antigen test, which is a great test, also does provide faster results. So I think the expectation on the PCR side is maybe that we will continue to see decreased numbers of PCR tests done in our lab.
Does that affect the operation in the slightest?
Yes, it does. So we consistently are reevaluating our hours of operation and our staffing load. We have had to reduce staff so that we are operating efficiently and not wasting taxpayer dollars to continue to operate at our full capacity like we were at the peak. So we're just slowly working to reduce staff to meet that. But we also want to make sure that we're keeping enough staff on hand so that we can meet that surge capacity should something else come up, and also to continue to do the whole genome sequencing, which is the detection of that variant as well.
Thank you.
Any other questions for me? Okay, thank you.
Any other questions? Any questions for Lindsay? Danny's got a question online.
Dr. Mason, sorry.
Right, here we go.
Jean Shem, Hometown Radio Group, Minot and Botno. What is the false positive and false negative rates of Binax Now tests? And if someone is experiencing symptoms and tests negative, should they follow up on a Binax Now? Should they follow up with a PCR?
So unfortunately, I don't know the actual false positivity rate off of the Binax now, because our laboratory actually does not perform any of the Binax tests. We stick strictly to the PCR. However, I can address a symptomatic individual that does test negative on the Binax should have a follow-up PCR just to confirm, because there is a higher risk with those tests to have a false negative result. So PCR would then confirm. Thanks.
Jacob.
I got a question for the governor. I can just about guess what the answer is, but in the last week, we've been seeing some legislation about ending the state of emergency. You talked a little bit about a lot of guidance being pulled back over the past few weeks. Any discussions about ending the state of emergency anytime soon?
Every state that's able to have a state of emergency in still has a state of emergency in. I think South Dakota, Governor Genome in January extended hers through the end of June. We know that there are other mechanisms in other states. Minnesota's has to be re-upped every 30 days, so I think they're on their 11th or 12th. I would just say that the mechanisms that were in place in North Dakota, the existing set of rules, whether it was the Emergency Commission, which is made up of 2/3 legislators, the budget section, which met to approve the coronavirus relief funds throughout last year, and the emergency measures that we have in place, all worked, I don't want to say perfectly, but I mean, you can look at the results. North Dakota was well set up to deal with emergencies. And if you go back and look at what, as a state, it's maybe isn't a surprise. If you go back to the Grand Forks emergency, which was extended period of time when the city of Grand Forks was dikes were breached, and at that time, pre-Katrina, the largest evacuation in the United States pre-Katrina. We saw the massive flooding up in Minot, with over 4,000 homes affected there. Emergency systems worked. DAPL was a prolonged 8-month-long emergency. It worked. Here during the pandemic, it worked. So I think there's always a sense that people feel like, hey, we got to, change some things. My view is that things have worked really well, and that the time to do Monday morning quarterbacking would be after this emergency is over, not while it's still on. And while we're in a great spot here in North Dakota, as we shared with the national numbers, when you're still looking at 100,000 cases and new variants coming. We hope that there's increasing supply of vaccine, but we're still, have only got 11% of North Dakotans vaccinated. This is, we may feel a little bit like we should be, as I said many times, grateful to be in the great position we are, but when we've got free movement of travel in and out of North Dakota to the rest of the country, whether it's Arizona or Florida, whatever we have, interstate highways coming through here, we still need to maintain that readiness. That doesn't mean that the state of emergency needs to translate into business closures. I mean, we can have all kinds of, have our economy open, our schools open, but still have the state of emergency. So we shouldn't conflate those two. And in particular, the state of emergency is not something that governors around the nation just decided to do. The state of emergency touches the century code in dozens, if not hundreds of places, and it does relate to how a state can apply for and qualify FEMA dollars, for example, during these emergencies. And so it's not a simple thing. You can't wave a wand and say, I'm going to make that go away, when in fact we're deeply integrated between the two. And just last week, for example, we were on a call and the White House said, hey, we're changing the reimbursement rate from a lower percentage to 100% for Section B of XYZ code. And so now some of the things that you used your CRF dollars for last year can be reimbursed by FEMA. And it would be a shame for North Dakota to be on the sidelines and not be in a state of emergency and not be participating in all the federal funds. I mean, there's a $1.9 trillion emergency relief fund being considered right now. It would be a very odd time for our state to suggest that there's no state of emergency here, in North Dakota. But again, we can operate under a state of emergency with, not have it have any impact on citizens other than the positive impact of federal aid and cutting red tape, because a number of the executive orders related to the emergency were all related to cutting the red tape we needed, and the legislature right now is considering whether that's school funding for distance learning, whether that's licensure, say for a nurse from Minnesota being able to work in North Dakota. There's a number of those executive orders which are under consideration as positive red tape cutting common sense legislation. So that's there are some positive ideas coming. I know there's another bill related to reducing liability for businesses that have remained open during COVID, another great piece of legislation that's moving its way forward. These are all things that I think are, the positive elements that are coming forward from this. Jeremy?
Governor, I believe the current state health officer is employed on an interim basis still. Is your office still searching for a permanent replacement?
Yes, we have an executive search underway. We've interviewed some finalist candidates, and there's also, legislation relating to the health department and the human services department, and some of that uncertainty makes it a challenging time to do executive recruiting. I'll just leave it at that. But we've got great confidence in Dirk Wilkie. He's been doing a fantastic job as the interim and was the operating officer of the Department of Health prior and has been with us through the whole thing. And so he and the rest of the leaders in the Department of Health, we have a lot of confidence in their work. Okay, we seeing, Danny, any others online? Okay, well, again, thank you all for being here, and thank you particularly to the press corps and all those that are listening in. Everybody that's been a regular part of these briefings has also been part of the solution in helping move North Dakota forward. And so again, thank you all. And again, Molly, Dr. Mason, thank you for your great work and your team. Thanks for your presentations today. And we'll see you in the near future. Stay healthy and keep going forward, North Dakota. Thank you.